Good morning. Today I'm going to go over the top 3 things to manage plantar wart or verruca. First, most of my patients in my clinic have great success with the 40% salicylic acid, especially when it's used properly. I do not recommend any of the over-the-counter products that adhere on for warts because they have a glue that tends to be a skin irritant and makes the wart even more painful than it needs to be. So my tips of the trade are either you use an adherent like moleskin or duct tape, which has a chemical in the glue that is excellent for warts as well. The reason I recommend a very good strong adherent is we want the medicated acid to stay in the area where we want effective treatment. So 40% sal acid, you take a clean Q-tip, even the ones for your ears at home could work, and you want to just have enough acid, just a few millimeters of acid on the Q-tip, not much, and you put a thin layer on. Why? As you apply a strong adherent, whether it be duct tape or moleskin, you can also use waterproof band-aids if the other 2 options irritate the skin, because we don't want the medication to slide, and then also it protects the other foot from recurrent infection or chronic infection, and we don't want the spread of the wart to go to other areas of the foot. So that's number 1. Small amount of acid, moleskin or duct tape, and it needs to be used daily. I can't stress this enough. The warts is caused by a virus, and that lives in the blood. Likes the base of the skin where there's excellent blood supply. So we want to disrupt where its environment, and how you do that is daily use of acid treatment, and you will have good success with eradicating it. Tip number 2, I commonly see this type of infection in the foot in athletes that swim or involved in some form of formal sports, and also patients that have hyperhidrosis, which are overactive sweat glands. So we also want to control for moisture while we're treating this. You can use a product called Carpe, or you can use an over-the-counter antiperspirant spray, the same stuff for your underarms. If you have any issues or aluminum sensitivity, there are some organic products that are a natural antiperspirant that can be used on the foot. The over-the-counter foot sprays and powders are not effective. So that's tip number 2. Daily use of medicated treatments. Highly recommend 40% acid. Tip number 2 is control moisture for spread. And also there's number 3, taking a multivitamin with adequate amount of zinc and vitamin C. I recommend at least 500 milligrams to 1,000 milligrams of vitamin C, and that helps your immune system eradicate these infections. Thank you.